How can headaches be indicative of brain cancer, and what differentiates them from regular headaches? Are all seizures a sign of brain cancer? If not, what kind of seizures are more likely to be related to brain tumors? Can you describe the types of mental changes someone with brain cancer might experience? For example, would memory problems be forgetting appointments or something more severe? Headaches, seizures, and mental changes can indeed be symptoms of brain cancer, but it's important to note that these symptoms are not exclusive to brain cancer and can occur due to various other conditions as well. Here's a closer look at each. 1. Headaches. Headaches associated with brain cancer are often described as persistent, progressively worsening, and different from usual headaches in quality or intensity. These headaches may be more severe in the morning or upon waking and may be accompanied by other symptoms such as nausea, vomiting, changes in vision, or neurological deficits. However, it's important to recognize that most headaches are not caused by brain cancer, but rather by more benign conditions such as tension headaches, migraines, sinus infections, or other factors. 2. Seizures. Seizures can occur in individuals with brain tumors, but not all seizures are indicative of brain cancer. Seizures related to brain tumors are often focal seizures, which originate in a specific area of the brain and may cause symptoms such as altered consciousness, involuntary movements, sensory changes, or unusual sensations. Generalized seizures, which involve both hemispheres of the brain and typically cause loss of consciousness and generalized convulsions, are less commonly associated with brain tumors. That's helpful. Besides genetic factors, what are some environmental exposures that can increase the risk of cancer? Certainly. Besides genetic factors, several environmental exposures have been associated with an increased risk of brain cancer. These environmental factors may include 1. Ionizing radiation. Exposure to ionizing radiation, such as that from medical imaging, e.g. CT scans, radiation therapy for other cancers, or occupational exposure, e.g. nuclear industry workers, has been linked to an increased risk of brain cancer. 3. Chemical exposures. Certain chemicals and industrial pollutants have been implicated as potential risk factors for brain cancer. These may include pesticides, solvents, metals, e.g. lead, cadmium, and other environmental toxins. Occupational exposure to these chemicals in industries such as agriculture, manufacturing, and chemical production may pose a risk. Interesting. Now, moving on to recent advancements, what are some promising new approaches to cancer treatment? Certainly. There are several promising new approaches to brain cancer treatment that hold potential for improving outcomes and quality of life for patients. Some of these approaches include 1. Immunotherapy. Immunotherapy has emerged as a promising treatment approach for brain cancer. Strategies such as immune checkpoint inhibitors, CAR T-cell therapy, tumor-infiltrating lymphocytes, TILs, and cancer vaccines are being investigated for their ability to harness the body's immune system to target and destroy cancer cells in the brain. 2. Targeted therapies. Advances in genomic profiling and molecular characterization of brain tumors have led to the development of targeted therapies that specifically target genetic mutations or altered signaling pathways in cancer cells. Drugs targeting specific molecular targets such as EGFR, BRAF, and IDH mutations are being studied in clinical trials for various types of brain cancer.